Hi there, my name is Dr. Mashhood. I'm one of the consultants in emergency medicine and you're watching my YouTube channel. If you like the videos on this channel, please hit the subscribe button. In this video, we're going to talk about the fact that if a patient gets the first dose of COVID vaccine and if they do a RT-PCR test, can it be positive? And if it turns out to be positive, does the patient really have the COVID virus or not? Before we answer this question, the first thing to remember is to understand what an RT-PCR test is. RT-PCR test, or the reverse transcription polymerase chain reaction, which is normally called a PCR COVID test, normally detects an RNA of a COVID virus. So if there is sufficient amount of RNA present in the swab sample which is taken from your nose or the throat, then the test will be positive, and then you might turn out to be COVID positive, having COVID infection. But for the test to be positive, you need to have a sufficient number of RNA to be detected on the swab test. Now, if you look at the vaccines, most of them, although are RNA vaccines such as Pfizer, you got Moderna, AstraZeneca is a DNA, whereas Sinopharm is an inactivated virus vaccine, and the Sputnik is a viral vector vaccine. These RNA and DNA vaccines have very limited amount of RNAs present in their vaccines. So the quantity of RNA in these vaccines are extremely low. Along with the fact that it's very low, these RNAs which are in the vaccines cannot multiply or replicate. So they cannot come or produce enough number of RNA of the virus to be detected on the RT-PCR test for the COVID. So this notion, this rationale that if you get a vaccine and you test yourself after a couple of days, you will be COVID positive and that's because of the vaccine, is entirely incorrect. The COVID vaccines cannot give you a positive RT-PCR test immediately, although it is not recommended to routinely get a RT-PCR test after a COVID vaccine after 2 to 3 days. There is no guidance that you should be getting a PCR test after the first dose. You should only get the PCR test done after the first dose if you're symptomatic and you're highly suspicious of a COVID infection. The only rationale you can be a COVID infection after the first dose is if you are a carrier of a COVID virus and you get a dose and the symptoms manifest themselves after the 2 or 3 days after the vaccines. That means you were carrying the COVID virus while you had the first dose of vaccine, and then you became symptomatic, not because of the vaccine, but because of the fact that you already had the COVID virus. There is no doubt, once you get vaccinated, your immune system gets activated and you're prone to infections. But that doesn't mean the COVID vaccine is giving you a positive PCR test. Although there is always a possibility of a false positive test, that cannot be ruled out. But this notion that the vaccine giving you a COVID positive test is generally not considered to be true. So only get yourself tested if you're symptomatic and you highly think that you might be carrying a COVID infection. But please go ahead and get your first dose of vaccines. If you're asymptomatic, don't worry about the COVID infections. What's very important is that you're getting your first dose of vaccines. If you like this video, please subscribe to this channel. Thank you.